Hey, I'm Catherine Holmes, and I'm a nursing student at the University of South Alabama. And I'm going to give you a room check. Here's my supplies. Here's all this. And my iPad is dead, but I'm using my phone now, so I'm going to use it as a prop. So first I'm going to plan for medication administration. So I'm going to avoid interruptions. I'm going to close off doors. I'm going to not take any phone calls. I'm going to limit my conversations with my colleagues to only essential information, and then I will follow the hospital's no interruption zone policy. So first I will compare the MAR to the patient care order form with the 7 rights. So I'll start with right patient, which is Jaguar J. Jones. Jaguar J. Jones, date of birth is 8/25/1963, date of birth is 8/25/1963. So then right medication is Nalvin-R U100 insulin, Nalvin-R U100 insulin. Then right dose is 10 units, 10 units. Right route is subcutaneous, subcutaneous. Right time is 30 minutes before meals, 30 minutes before meals. Right indication would be insulin is given to stabilize blood glucose levels of patients with diabetes. And then I would look for allergies, which is penicillin, allergies, which is penicillin. So then I'm done with my order form. So I'm going to do hand hygiene, and then I'm going to do the first checkoff for the 7 rights. So I'll do right patient, which is Jaguar J. Jones. Date of birth is 8/25/1963. Then I'll do right medication, which is Nalvin-R U100 insulin, which is regular insulin. So I'll find it, Nalvin-R U100 insulin, which is regular insulin. The expiration date is 12/1/2025. So I'm going to read it to make sure. Okay, and I will show y'all. Okay, so then you'll do right route, which is given subcutaneously at a 45 or 90 degree angle. So I'm going to grab this 1/2 milliliter insulin syringe and show it to y'all, and it has the units on it. Okay, and then I would do right dose. So this is 100 units, and the syringe is measured in units, and I need 10 units, so I won't have to convert anything. So I will grab an alcohol pad and go from inside to out to avoid contamination. And then I will grab my syringe, and I will put 10 units of air. Yep, 10 units of air. Now I'll put that into my vial, and then put 10 units of insulin into my vial. Okay, so 10 units of insulin. I would also verify this with another nurse for medication dosage of insulin. So then I will swoosh to recap, and I'm done with that. So then I would do right time, which is 30 minutes before meals, and then right indication would be insulin is given to stabilize blood glucose levels with patients with diabetes. And then for documentation, I would make sure all elements of legal prescriptions are included. So then I would do the second check. So I want to compare the MAR to the syringe and the vial. So first I'll do right patient, which is Jaguar J. Jones. So date of birth is 8/25/1963. Then I'll do right medication, which is Nalvin-R U100 insulin. This is Nalvin-R U100 insulin, which is regular insulin. Then right dose is 10 units. This is 10 units. Right route is subcutaneous, and this is insulin, which is given subcutaneous, and this is insulin syringe. Right time is 30 minutes before meal. And then right indication would be insulin is given to stabilize blood glucose levels of patients with diabetes. And then right documentation is all elements of legal prescriptions are included. So next I'll grab this piece of tape, and I will document the patient's name, the name of the medication, and the dosage on here. So name is Jaguar Jones. Name of medication is Nalvin-R U100 insulin. And it is given 10 units and spell out units. So I'll make sure that's right real quick. Okay. So then I'm going to place it on my syringe, so that I know. So that's right documentation. So now, before I go into my patient's room, I want to make sure I have my MAR. I have my vial, my syringe, my gloves, and my goggles. So then I'm going to do hand hygiene. Now I'm going to walk into my patient's room and say, "Hey, Mr. Jones, how are you doing today? Today I'm going to give you your insulin shot because you have to have it 30 minutes before you eat, and it's going to help with your blood glucose levels." So then I'm going to raise the patient up in their bed. I'm going to lower the side rail. I'll position them comfy. So then I would I would compare the armband to the MAR. So I would start with right patient, which is Jaguar J. Jones, and date of birth is 8/25/1963, and date of birth is 8/25/1963. So that's for right patient. So then we'll says allergies for allergy band, penicillin, allergic to penicillin. Mr. Jones, are you allergic to anything else? No? Okay, great. So most time we'll do a pre-administration assessment. So I'm gonna assess your blood glucose levels before I give you your medicine and make sure you need this amount. And then, so we did the right patient for 7 rights. So now we're gonna move the medication. So 91R U100 insulin, 91R U100 insulin, then 10 units subcutaneously, which is right route. Right time is 30 minutes before meals. Right indication is insulin is given to stabilize blood glucose levels with patients with diabetes. And then documentation is all elements of a legal prescription are included. So now I'm going to put my clean gloves on. Okay. Struggling just a little bit. And then my goggles. Okay, goggles. And then I'm going to tell you where I will give the injection for insulin, which is in the abdominal injection site, which is below the costal margin, above the pubic region, between the anterior superior iliac spine, and 2 inches away from the umbilical region, which is your belly button. So you would do this subcutaneously, so it would go to 45 or 90 degree angle, but I'm going to do it 45 because most time for insulin you give it at a 45 degree angle. So I'm going to get an alcohol prep pad. I'm going to go from inside to out, make sure I do not contaminate. Okay, I'm going to grab this. Then I'm going to pinch the skin and go at a 45 degree angle and give slow and steady up. Then put this in the sharp container and then gently put pressure on the injection site. Okay, and then I'm going to remove my gloves, which is glove to glove, skin to skin. And then I'm going to make sure that my patient is not having an allergic reaction to their medicine, and they are not. So I'm going to position him comfy again, and then I'm going to raise his side rail. Raise his side rail, lower his bed, and then I'm going to go document the procedure I did in the MAR. And then afterwards, I would reassess the patient to make sure that their medicine worked for their blood glucose after their food to make sure it's at the right level and it's not too high for people with diabetes. And that concludes my checkoff.